The Ottawa ankle rules are used to identify when radiographs are needed for the ankle or foot. Indications for the ankle include tenderness along the tip of the posterior edge of the distal 6 centimeters of the lateral malleolus, tenderness along the medial malleolus, and or the inability to weight-bear 4 steps. Indications for the foot include tenderness at the base of the 5th metatarsal, tenderness at the navicular, and or the inability to weight-bear 4 steps. The test item cluster for those who would benefit from spinal stabilization include age less than 40 years old, average straight leg raise greater than 91 degrees, aberrant motion which includes the pseudo-Gower sign, painful arc, reversal of lumbopelvic rhythm, and instability catch, as well as a positive prone stability test. Elise, I'm going to have you fix your hips against the table there and go ahead and lay down. Good. Let me know when you have any pain.
Right there.
Good. Go ahead and hold on to the table and lift your legs off the ground. Has that pain changed in any way?
Yes.
Good. The test item cluster for those who would benefit from spinal manipulation includes symptoms less than 16 days, no symptoms distal to the knee, an FABQ work subscale score of less than 19, at least one hypomobile lumbar segment, and at least one hip internal rotation greater than 35 degrees. The McMurray test is used to test for meniscal pathology. To test the medial meniscus, the tibia is externally rotated. To test the lateral meniscus, the tibia is internally rotated. The anterior drawer test, which tests the integrity of the ACL. The slump test is a neurotension test for the lower limb. I'm going to ask you to put your hands behind your back. Go ahead and slump down for me. Good. Bring your chin to your chest. Apply overpressure. Just straighten the knee. Flex the ankle. If the patient is having symptoms, I ask them to lift their head up, and then I would ask if any symptoms have changed. The test item cluster for patients with hip osteoarthritis includes self-reported pain with squatting, painful active hip flexion, painful active hip extension, passive hip internal rotation less than 25 degrees, and a positive scour test, especially in the internal quadrant. The Faber test is used to assess the hip joint, the SI joint, or the iliopsoas muscle. The Ely's test checks for tightness in the rectus femoris muscle. I would check both sides to compare. A diagnosis of gluteal or hamstring weakness may include isolated weakness in hip extension, abduction, and external rotation, isolated knee flexion weakness, positive Trendelenburg sign, where the uninvolved side would drop, normal reflexes and sensation, and active range of motion deficits due to weakness. A diagnosis of L5-S1 radiculopathy may include radiating pain into the lower extremity, sensation deficits in the L5-S1 dermatome, myotomal weakness in plantar flexion, knee flexion, and great toe extension, diminished or absent Achilles tendon reflex, a positive straight leg raise, and a positive well leg test. Symptoms would be in this leg for the straight leg raise, and in the other leg for a positive well leg test. A positive slump test, which was demonstrated previously, and abnormal imaging.